Yeah, thank you, ladies and gentlemen. Welcome back to the channel. It's my take on it with Dr. Victor Obasuyi. Today, I'm going to be taking you guys through diabetes and the eyes. Yeah, the reason I'm doing this is from time to time, I notice that when patients are diagnosed with diabetes, they tend to freak out. Diabetes is not the end of the world. As far as diabetes is concerned, the more you know about it, the better your chances are of coping with it. There are two basic things that we should know about diabetes, and that's the origin of it. Genetics, which means your family history, and lifestyle habits. Those are the two basic things that we should know about diabetes. If you have a family history where you're very prone to diabetes, then obviously as time goes and as with age, most likely you end up with it. Some people have lifestyle habits that make them prone to diabetes. Sometimes they don't even know. So for those that are diagnosed with diabetes, those are the ones that I'm addressing this issue to, so you know how it relates to the eyes. As far as managing diabetes is concerned, we have two options. We're looking at what goes into our body and how it goes out. So sugar starts to accumulate when whatever is coming in is more than what is going out. If there's an imbalance between incoming and outgoing, then the risk for diabetes is higher. So if we can't control genetics, which is your family history, it leaves us with the only option of controlling our lifestyle habits in terms of diabetes. And what do? The two main things as far as lifestyle habits is concerned is what we put in our mouth, which is diet, or the food that we eat, and exercise. These are the two most important things. So what we put in our mouth, this is where we talk about things like the food that we eat, the diet, whatever we consume. How we get rid of it is where we talk about things like exercises. A lot of people just put in, and they don't make any effort to get rid of it, which means they don't exercise. Walking is not part of it. If you notice, like most of the older people back home were not as plagued with diabetes as we are today, and that's because a lot of them engage in farming or lifestyle habits that keep them outdoors most of the time. A lot of them trek how many kilometers to get to their farms. By the time they get to a farm, they have to walk, so they sweat out a lot of things. But modern day, all we do is we just drive to work, we sit in the office. So a lot of times you really don't have time to burn out all the sugar that you have in your body. So what we need to do most if you are diabetic is to make sure that exercise is part of your daily routine. Whenever you have the time, if you're going to run, participate in running, soccer, sports. These are all the things that can help you burn out fats. But the most important thing is on a daily basis, the number of time you spend sitting down in front of sitting on the couch or just sitting doing nothing should be minimized as much as possible. Exercise, you can always go on a treadmill. You can do that at home. There are so many exercises you can do at home to burn these calories. Then in terms of food, there are things that we can do. We can work with there are so many diabetic clinics around that can guide you in terms of the food that you eat. And most of these diabetic clinics, from time to time, they organize symposium where they bring people in to talk to diabetic patients about their lifestyle habits. So if you register with a diabetic clinic, most times they will guide you through. So if you go to diabetic clinic, they have diabetic symposium. Most times they have nutritionists that come in there too. And that's another option that you want to look at. Nutritionists can tell you how to balance your diet without you starving and still having the right intake of the nutritional value that you need without the excess carbohydrates. So what you want to do is reduce your carbohydrate intake, increase your protein and the veggies. A balance will help a lot. Then sugar. So a lot of patients don't bother going to their family doctors, which is not good. So a lot of them don't bother checking their sugar at home. Neither do they bother with even the 3 monthly A1C or taking their medications. So these are the things that basic things that you need to do if you know you want to bring your sugar level like really down. If you check your sugar level on a daily basis, it helps you understand which food raises your sugar up, which food that you eat that doesn't really take the sugar high. So you understand activities that you do that will help your sugar come down. So that's the essence of checking your sugar on a daily basis. The A1C at every 3 months is good, but it kind of gives you a sum of everything that you did within that period. So you don't really know on which the diurnal or the daily variation in the sugar level, unlike when you're doing it yourself at home. For me, I find that most of the patients that take time to monitor their sugar at home do a lot better in controlling their diabetes compared to the ones that don't. I had a patient one time that from time to time he comes and the sugar level is always on the very high side. I'm talking about almost 17, 18, thereabout. Family doctor has sent him to different diabetic clinics, and the sugar wasn't coming down at all. And the signs of diabetes were already beginning to show in his eyes when I did the test. So I sat down with him, and in asking him questions, the guy, he told me that he's doing everything that he was asked to do, but the thing is that sugar just doesn't come down. Guess what happened? I saw him maybe about an hour or so later. I went to the mall, and I saw my friend coming out from McDonald's with a big cup of Coca-Cola, which obviously is a no-no, especially for an uncontrolled diabetic patient like him that's on insulin, metformin, and the sugar level is still climbing into 15 and 18 region. So these are things that if you're ready to work with your doctor, then follow their instructions exactly the way they said. There's no need for you to cheat. At the end of the day, if you cheat, who are you cheating? You're cheating yourself. So this is why it's very important to check what you in your body. It's very important. So when you check your sugar, it's always good to make sure that you keep it in the single digits. It's even better if you can get it less than 8. It's better that way. So check your sugar at home. Make sure it's in single digits and less than 8. If you do this, you find that most times you may have diabetes, but it's very well controlled and it won't bother you. Diabetes is one of those conditions where if you don't bother it, it won't bother you. You can comfortably live with it for the rest of your life and it won't bother you. But the more reckless you are with diabetes, the more problems you invite to yourself. Also, make sure your eye examination is done on a yearly basis or 6 months as your eye doctor deem fit. During your annual eye examination, your doctor will usually put drops in the eyes to check the back. Whatever, based on what the doctor says at the back of the eye, might recommend for you to come in every year or come in every 6 months. But you must make sure that at least once a year you get your eyes checked. Diabetes is the number one systemic disease that causes blindness, and that's why we don't take it for granted. So I strongly recommend that if you're diagnosed with diabetes, at least once a year, go to your eye doctor, have it checked. Diabetes, if uncontrolled, it does not just cause blindness, it can also ruin almost every organ in your body. And that's why it's important to make sure that we check it frequently. And if you take these few precautions that I have mentioned, you can comfortably live with diabetes without diabetes having to ruin your life. So thank you, ladies and gentlemen, for your time again. I appreciate every one of you for watching my videos. Comments are highly welcomed. If you have questions, throw them in the comment section. I did a few videos on diabetes before, so if you want to see them, you can always go check in my previous videos, and I'll try to put the link in the comment section below, so you can take a look at those videos. Whatever I say may be common sense to you, but to the other person, it might not be. And you might be saving the next person by sharing this video. So thank you, ladies and gentlemen. Victor Obasuyi. I'll see you next week in my next video. Thank you.